The man with the job of sorting out a controversial new test used to decide who will get sickness benefit has told this programme that he plans to make unannounced visits to job centres. Job centres are the first port of call for anyone who wants to claim the new Employment and Support Allowance. Professor Malcolm Harrington will do the spot checks to see if changes that he's already asked for are happening, and we'll be talking to him in a minute. But first, our own disability specialist, Carolyn Atkinson, has a bit of background on it. Carolyn.
Well, the new benefit, Employment and Support Allowance, was brought in 2008 and it replaced 3 other incapacity benefits. Now, the way people are assessed for it has been really controversial, and the Coalition agreed that it wanted to sort things out, and it asked Professor Harrington to investigate. It's controversial because lots of people who insisted they were too ill to work were being told they were fine, they lost their money, or they got less money, or they were simply told to get a job. And we've had people contacting us on You and Yours, for example, with relatives assessed as being fit for work who died shortly afterwards as they were about to appeal. Now, a more typical example, though, could be somebody like Jenny Fletcher, who has severe depression and a number of physical disabilities. Back in April, I went to Portsmouth, where she was having her work capability assessment. That's the test you have to have. She'd previously failed 2 others, but one had been overturned and she'd won the other on appeal. Now, I waited outside the building for 1 hour and 3/4 while she went inside with her community psychiatric nurse, and when she came out, it had not gone well.
We were told that the assessment when we got in would be half an hour. When we got in the assessment, he said no, it's going to be at least 1 hour and 1/4. So we've just been messed around, and
all in all, you're no further down the route.
No further down the route, and feeling very angry, as well as all the stress. I'm just so wound up now.
I spoke to Jenny again earlier this morning. I spoke to her to find out the latest.
I eventually had my assessment on June the 9th. I didn't get any immediate response from the DWP. 6 weeks later, all I'd had was a letter confirming my benefit, no reference to the assessment. So I asked for the medical report and I eventually got it.
And you have enough points, so you've been put into a category deemed unable to work at the moment.
I've been put into the work-related group. I'm happy to have got enough points, but going through the report in detail, I'm not happy that the depression was the major thing that got me enough points to be declared unfit for work. I think it was my other health problems, and that really worries me.
Jenny Fletcher. Now, charities and support groups up and down the UK have been extremely worried about this test, as we've been reporting on the programme. In Glasgow, a GP who was noticing that some of her patients whom she considered too ill to work were going for the test and then were being told they were fine. Dr. Margaret McCartney decided to investigate, and she went off to a recruitment evening for new assessors. They can be doctors, they can be nurses or physiotherapists. And she wanted to find out more about how the tests are carried out. She's written up her findings for the British Medical Journal, and she told me why she took action.
I had noticed that I'd been getting some reports through basically saying that my patients were no longer going to be entitled to benefits on the basis of their recent medical assessment. And I was surprised by some of these reports and also a bit perturbed. And at that point I decided to just do a little bit of background reading and find out really what was going on and how these decisions were being made, because it wasn't something that I felt was concordant with my knowledge of the patient.
Now, getting the test right is crucial not least because since April, around 1.7 million people on the old incapacity benefit have started being called in to see if they qualify to claim the Employment and Support Allowance. And in fact, there are now 11,000 assessments roughly being carried out each month. But the criticisms do keep on coming. The Department for Work and Pensions Select Committee is less than impressed. It published a report earlier in the summer saying the test is causing fear and anxiety amongst claimants, and they say it leaves people thinking that the government's only objective is to save money. Now, the tests are done by a company called ATOS, under contract to the Department for Work and Pensions. The doctors' regulator, the General Medical Council, confirmed to me this morning that there are currently 10 investigations going on at the moment relating to 8 doctors employed by ATOS, and that 2 of those cases directly relate to their work for ATOS. Now, the government say they are listening and listening intently, not least because at the moment around 40% of people who take their case to appeal win, and that figure is often higher if people are represented. The Lib Dem conference next month may end up debating a motion brought by Liberal youth about the work capability test. But at the moment, the coalition is relying on Professor Malcolm Harrington. He's on year 2 of a 5-year review, and he wants to know from listeners what their experience has been. You have until Friday, September the 16th to get in touch, and the details of how to do that are on our website.
Karen Atkinson, thank you. Well, Professor Malcolm Harrington is here in the studio with me now. Professor Harrington, you're going to spend some time hanging around in job centres. Why?
Well, partly because, although I visited a number in the course of the first year and the second year, and this year I've been to Aberdeen where the new IB rollout occurred, and I've also been to Plymouth twice. But I didn't want people to think that I only went there when I went along and people knew I was going and everything was going to be fine, because they wouldn't they? And so I got permission from the department to give me a list of potential major sites, say in the southern England, just for logistical purposes. And I said, I just want to turn up. I just want to go there for an hour, no longer, have a word with the manager and ask the decision makers, have things changed for you? Is it better than it was? And if it's not, why isn't it?
Because you asked for a number of changes, didn't you? You're not confident, I take it, that they're being implemented.
They've all been accepted, every one.
By the government, they have.
By the government. It is now DWP policy to implement all the changes from the first-year recommendations. That includes the ones related to ATOS, because ATOS are under contract to the DWP, and so that will happen on that basis.
So changes to the test ATOS should be looking at. What should be happening in the job centres then?
They should be less mechanistic and more human about the way in which they handle people.
Nicer to people?
Nicer to people. They've changed the telephone system, they've changed the words they use from the call centre, they've changed the wording on the letters. There's more opportunity to have a dialogue with the claimant, and the claimant is now told early on what it is they expect to have happen. And most importantly of all, I want to emphasise to your listeners, is that the ATOS test, if I may call it that, is not the be-all and end-all of this assessment. It's only part of it. It's not even the major part now. The really important thing is the claimant to make sure all the corroborative evidence that they want to be considered in their case is made available.
Because at the beginning, they did the test and assessed you, didn't they, without looking at any corroborative evidence. Am I right?
You can't guarantee that at the ATOS assessment they will look at corroborative evidence. Some of them do, some of them don't. But there's a very important person in this who's called a decision maker. And the decision maker needs to make decisions. And up until now, a lot of them have been rubber stamping the ATOS assessment. What I want to have happen, and they're being trained to do this, and the ones I've spoken to really like the fact that they've been empowered, is they are now in the centre of this. They collect all the information from the claimant. They ask the claimant who is their preferred healthcare advisor. They collect the ATOS assessment. They bring it all together, and then they make a decision. Before they make that decision, they contact the claimant and said, look, this is what I'm going to do. Have you got any other information you want me to consider? Now that, I think, will be a fairer and more effective assessment and should involve less people going to appeal because they feel they've had a decent deal.
Now, you're asking for evidence. Who is it in particular that you want to hear from? Because you have been suggesting these changes, haven't you? There's no point you taking evidence from people who were assessed ages ago, is there, really?
No, you're absolutely right. And I think the point that Caroline made earlier is the fact that looking at what happened to people in April probably is not relevant anymore. Now, I don't expect this to have occurred right throughout the country. I had a number of major meetings with the big charities and support groups earlier this month. And some of them said, yes, I have seen some changes. And others, I think, more circumspectly and more reasonably said, no, but I expect them to come. And some are just saying nothing's happening. Now, it could be that nothing's happening because nothing's happening. It hasn't been rolled out to that particular part of the country. But if it's by the end of the year, we're not seeing some positive effects, I would be astonished, because it is happening. The training is taking place. And quite frankly, the people who are doing it want to do it. I mean, some of my recommendations have actually been improved by being rolled out by the JCP, and they're now saying, well, why don't we do this? I think this is a better way. And I said, terrific.
Professor Harrington, thanks very much for coming in. There is a link to your website, gathering information on our website. We asked the government for a contribution. They say, as Professor Harrington's just said, we're committed to ensuring the work capability assessment is fair and accurate. That's why we'll keep it under independent review for 5 years to make sure it's working properly. We have accepted all the suggestions made by Professor Harrington in his first review, and we're looking forward to receiving his second review later on in the year. These reforms are vital and will allow us to help those who can work into work and to continue to support those who cannot.